Good afternoon, everyone, and welcome to our health talk. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for attending today's session on sleep and sleep disorders. I would like to take a minute to thank our planning team. First, the Patient Education and Engagement Program, the Patient Learning and Experience Centers, and Education Technology and Media Services. Now, a few words about our online format today. This session is being recorded and will be available for viewing with closed captioning at the same YouTube link afterwards. Today, we'll have a presentation for about 30 minutes, and then we'll open it up to the audience to ask questions for the rest of the session. If you have any questions about the live stream during the session, you can email us at pfep@uhn.ca. You can also request to arrange a phone call in your email, and a member of our team will get back to you shortly. On the topic of technology, we realize anything can happen when it comes to the internet connection. So with that said, if my internet should cut out at any point, please don't worry and hold on tight, and you'll be seeing one of my awesome colleagues step in to facilitate the session. We also want to note that some of our speakers are presenting on site at the hospital. Because of that, you may hear announcements or alert codes in the background. If this happens, we'll take a few seconds to pause until they're complete. To submit your questions for the presenters, we invite you to go to the link on your screen. It's also in the description box below, and we'll also have it on some of the slides. You can submit questions anytime during the presentation. We want to quickly thank those who have submitted questions already. It helps us see what people are most interested in learning about most. We've tried our best to address these within the presentation, but we can also answer them again if needed during the question and answer period. When you submit your questions, you may notice it doesn't get posted right away. This is because we're reviewing questions before they show up for the audience. This helps us make sure questions won't be repeated, and it gives us more time to address new and different questions. It also helps us prepare how to answer the questions before they're posted if needed. We ask you to please keep in mind a few things before you submit your question. First, you can choose to include your name or stay anonymous. Please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only. The speakers are not here to diagnose or provide treatment recommendations. We'll also try our best to answer as many questions as we can during the question and answer period. And finally, you can also vote for your favorite questions by clicking the thumbs up button beside the question. This helps us bring the questions closer to the top, and they'll more likely be answered. Your feedback is really important to us, so please go to the link on your screen and complete the survey at the end of the health talk. It's also in the description box below. We thank you in advance because your feedback will help us know what you liked, what we can improve on, and what topics you would like to see in the future. Now, moving on to our presenters. Research associate and community expert Renee Adams has advocated for the greater promotion of the social determinants of health, especially where it concerns our most marginalized populations over the past 15 years. She has volunteered for many organizations at the local, provincial, and federal levels, including the Stop Community Food Center, Income Security Advocacy Center, Citizens for Public Justice, and UHN's Patient Partner Program. She uses her lived experience of homelessness, community work, and sleep apnea to inform the development of sleep study technologies. We'll also hear from Opel Sparks, who is a proud Torontonian who has been involved in many poverty initiatives, including Wellesley Institute, ODSP Action Coalition, Social Planning Toronto, Daily Bread's Hungry City and their poverty reduction strategy, as well as the People's Blueprint, the Stops Advocacy Project, Campaign 2000, Raise the Rates, Elder Abuse with U of T Springtide, Access Alliance consultations, CAMH consultations, $15 in Fairness campaign, just to name a few. Opel uses a mobility scooter due to an unexpected accident, and she is grateful for each day and strives to be involved. We'll also hear from Dr. Marisol Campos Navarrete, who has a Bachelor's of Science in Engineering, a Master's of Arts in Sustainability Studies, and a PhD in Indigenous Studies, and 20 years of experience working with Indigenous communities in Mexico, Central America, the United States, and Canada. Her current research interests address Indigenous-led and intercultural research methodologies and approaches to further local sustainable development while embracing interacting social, cultural, economic, and environmental dimensions of community well-being. And finally, we'll hear from Dr. Azadeh Yadawahi, who is a senior scientist at the University Health Network's Kite Research Institute, or UHN Kite. And that she's an associate professor at the University of Toronto's Institute of Biomedical Engineering and an adjunct faculty at the University of Manitoba. She leads the Sleep DP laboratory at UHN Kite, one of the few facilities in Canada dedicated to studying the complex relationship between sleep, hemodynamics, which is the flow of blood within the organs and tissues of the body, and cardiorespiratory disorders. Dr. Yadawahi is a strong advocate of inclusion, diversity, equity, and accessibility, or IDEA, and she chairs the UHN Research's IDEA Committee. So we have a great group of speakers today. Before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we're presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you to do the same too wherever you're currently located, that we're still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. We're grateful to have the opportunity to work, learn, and play on this territory. During today's talk, our speakers will discuss barriers to getting diagnosed and treated for sleep disorders, and many of these can be linked to the intergenerational impacts of colonialism. We hope today's talk will inspire you to reflect on how this history has shaped the health and healthcare access that Indigenous communities experience today. I'm looking forward to the speakers guiding us in this learning and providing suggestions on how we can ensure everyone is receiving equitable and safe access to care. On that note, until about 1:40 p.m. today, the presenters will also talk about the connection between sleep and health, common sleep disorders. They'll share their lived stories and experiences with sleep apnea, how to diagnose and treat sleep disorders. They'll talk about the barriers, as well as some resources at UHN and in the community. Now I'll turn it over to Dr. Yadawahi. Thank you.
Thank you very much, Melissa, for the great introduction and for having us today. We're so honored to be here and learn more from you, and then also share our work with you and all the other attendees. What is sleep and why sleep is important? So sleep is an active state of unconsciousness that is produced by body. And what happens is that it's mainly to make sure that the brain and the rest of the body are getting some rest and don't react to many stimulus that they experience during daytime. So it is a state of rest for the body. Next slide, please. Why do we sleep? There's so many theories about that. And then why should we waste 1/3 of our life sleeping? But the point is that there are different reasons of why people sleep, or even humans, animals sleep. One of them is inactivity theory, that is more of evolution, that it could have been that it was safer to adjust to the environment if the animals and creatures, including people, were sleeping or were inactive during the night, less wolves. The other one is like energy conservation theory, that during the sleep, the demand of the energy from the body is less, and then so it is more efficient in terms of hunting for food. The other one is more toward the functionality and restorative theory, that the sleep allows the body to repair and increase cell progress and basically the health for the whole body. And something that is also very relevant is about the brain plasticity theory, that the sleep is very important and needed for the brain to recover, restructure, and then also even learn new things. And that's why many times they say that if you practice something before sleep, the day after or after sleep, you remember better and you learn better. Next slide, please. And when we're talking about the sleep, one of the things that is very important to remember and know about is that the circadian rhythm or our internal clock. So as you all know, we do have this internal clock that controls everything that we're doing in the body, specifically the sleep-wake cycle. And the main factor or the main hormone that controls our internal clock is a hormone called melatonin. And this melatonin is driven by light. So when it's sunlight, then we wake up. When there is less sunlight or it gets closer to the night, then we have more drive to fall asleep. And that's one of the main reasons that we don't want to have too much exposure to blue light at night, because that resembles the daytime. Or we want to have more exposures to red light at night to help us to fall asleep better. Next slide. When we think of a sleep, every person has different stages of a sleep. And it's usually 4 to 4. We have 2 main stages of a sleep that called the non-REM and the REM sleep. REM means rapid eye movement, or the dreaming stage of the sleep. And the non-REM is basically before getting to the dreaming stage. And the non-REM is divided by 3 stages. Stage 1, that is just falling asleep. That's like starting to dozing off. And then a stage 2, which is a bit deeper than a stage 1. And a stage 3, which is the deepest stage of the sleep. And after that, we go to REM sleep. So we have this cycle of a stage 1, 2, 3, REM sleep. And this one whole cycle lasts about 90 minutes. And we may have multiple cycles throughout the sleep, depends on the length of the sleep. It doesn't mean that we always have all of these stages, and that changes over the age, but usually these are the sleep stages that we have. Next slide. And when we're talking about the sleep disorders, there are so many disorders of the sleep, depending on the functionality and then the symptoms that are there. We're here going to talk about a few of them that are more common. Next slide, please. So before going more in depth in terms of the sleep disorders, I would like to invite Renee Adam to give us an overview of her experience with the sleep problems. Renee?
Thank you. So my name is Renee Adams, and my sleep apnea was diagnosed at the Toronto Western Hospital Sleep Lab. Although there were and are still many contributing factors that affect my quality of sleep, this testing was important and an important part of confirming that I had sleep apnea. My doctor provided a great treatment plan to help address my issues. This included the use of a CPAP machine. And I believe that using my CPAP machine has contributed to my weight loss, as the quality of my sleep has led to more daytime energy. And when the sleep study was repeated, I was happy to hear that I could lessen the pressure of my CPAP machine, which I attribute to my weight loss that I had achieved. I would like other patients to know that it's important to trust the process. We live in a fast food world, but that doesn't always translate to addressing our health needs. With new pressures being placed on our healthcare system, I hope that my input will aid in the development of new and future technologies that will not only help to break down barriers and speed up the diagnosis of sleep apnea, but contribute to faster and more accessible testing options for all community members to support their social determinants of health. I'm grateful for the care that I've received through the UHN network. Thank you.
Thank you very much, Renee, and thank you for highlighting the importance of weight and weight loss on the sleep apnea. Next slide, please.
So what are sleep disorders? Some may have a sleep disorder if you have one or more of the following signs. If you have trouble falling or staying asleep. If you have trouble staying awake during the day. Changes in the circadian rhythm that affect your healthy sleep-wake schedule, and experiencing unusual behaviors in the body that disrupt your sleep. Next slide, please. So some of the categories of sleep disorders may include insomnia, parasomnia, sleep-related breathing disorders such as sleep apnea, somnolence disorders, sleep-awake disorders, and sleep-related movement disorders. Next slide, please.
So for insomnia, it is usually about difficulty falling or staying asleep. It affects about 10 to 30% of the adults, and there are many factors that could contribute to insomnia, such as stress, pain, if people are having irregular sleep schedule, or depending on the lifestyle. For example, COVID and the stress of COVID has shown to increase insomnia around the world. Lifestyle and some conditions such as mental health or pregnancy could contribute to worsening of insomnia. Next slide, please. The other condition is called parasomnia, and it usually happens if there is a mismatch between our need of the brain to basically stop all the activities and our muscle control. So what happens is that during the sleep, our brain activity is reduced. And at the same time, many of the muscles are become inactive because we don't want to start walking when we were dreaming about walking. But if there is a mismatch between these two parts of our different sleep stages and how our muscle activity should be, then there would be the problem called parasomnia. Some of the examples, for example, is the sleepwalking. That means that the people are dreaming and the muscles are supposed not to be active, but they are, and they start to walk. It's also quite common during the REM stage of sleep, which is the dreaming stage, and people start to be vocal or active on their dreams. It's not just for humans, even dogs. I'm sure that you've seen videos of the dogs in their sleep and then just kicking and running away. The other part of that is just sort of the opposite of that, is called sleep paralysis. That when the brain is waking up, but the muscles are not waking up. So the person is waking up, but they can't move their muscles and they feel that they're paralyzed. So it's the other side of the sleepwalking, for example. And some of them are the nightmare disorders, which are to have unpleasant dreams. Next slide, please. Now I would like to ask Opal to give us a presentation and talk about her experience with the sleep problems. Opal?
Thank you, Azadeh. And thank you for today's talk about sleep apnea. I was diagnosed for sleep apnea just prior to returning to Canada. So a couple of years later, through my new healthcare here in Canada, I asked if I could do a sleep study, and unfortunately the sleep study was not completed. So I'm now in the process of having that done within the next couple of weeks, and I'm really excited to that, because one of the things that I notice as somebody who has sleep apnea is that I do not sleep through the whole night. I wake up several times during the night, coupled with chronic pain. It's difficult for me to sleep, but I often wake up with very sore throat or very dry throat. And sometimes I wake up in the middle of not having breathed or having taken a breath. And so I'm really noticing the impact of sleep apnea in my own situation. And the other thing that I've found out through doing a lot of research on my own while I'm waiting to get the sleep study completed is that it's really difficult to get through a day. Sometimes I'm really fatigued because of lack of sleep. And so I'm really realizing the importance of completing the sleep study and really finding out the best possible care that I can obtain through the kinds of support that one gets when they're diagnosed with sleep apnea. So I'm really looking forward to finally completing this process. It's been a long it's been a long road, but I just want to caution people that if you have thoughts or experiences that show you that you may have a disorder of any kind, whether it's waking up from sleep paralysis where your body just feels like it can't move, or any other kind of situation like nightmares, or not being able to go deep enough into sleep, or not being able to go to sleep, it's really important to get that kind of care because it changes the quality of our life. Thank you.
Thank you very much, Opal. And it was excellent, and very thankful that you presented about some of the symptoms and experiences that you have with the sleep apnea. And then also about some of the challenges, such as the long waiting time to get a sleep assessment that we try to cover to some extent in this presentation. Next slide, please. So very nicely touched with what Opal mentioned as her condition and her experience with the sleep apnea. The sleep apnea is a common chronic condition, and it is because the people stop breathing for periods of time during the sleep. It can be from 10 seconds and sometimes to even up to a minute or two that the people stop breathing or have very shallow breathing. And these episodes of no breathing can happen up to, say, even 60 times per hour or 30 times per hour. So it could be really affecting the amount of the oxygen that gets to the body and especially to the brain. And that's the biggest concern with the sleep apnea, the lack of oxygen to the brain. There are three main types of sleep apnea. The most common one is called obstructive sleep apnea, and it happens when our airway in the pharynx are collapsing when we lie down. So because of the gravity, because of the weight, when we lie down, these airways in the pharynx are collapsing and then preventing the air to get to the lungs. The other type of sleep apnea is called central sleep apnea. It is less common in the general population, and it usually happens when there is no problem with the airways, with the pharynx, but the brain is not sending the right signal for the breathing. So when we do need air or we do need to breathe, the brain thinks that everything is fine, and then we don't have to take a breath. And that's why it is called central sleep apnea. As I said, it is not common in the general population, but it is quite common in people with chronic conditions, like those with heart failure, those with kidney problems, or those with, like, for example, that may use substance. The other type is called mixed sleep apnea, when the people are having a mixture of obstructive and central sleep apnea. There are many challenges with the sleep apnea. The most common one is that sleep apnea increases the risk of chronic condition, such as high blood pressure, a stroke, heart attack, and the worsening of like asthma during the sleep. And vice versa, people with chronic condition are at higher risk of having a sleep apnea. Next slide, please. Very much in line with what Opal mentioned, there are several signs of sleep apnea that are arising because of that difficulty of breathing during sleep, and also awakening so frequently to get normal breathing. As a consequence, people with sleep apnea usually feel very sleepy and tired during the day. They wake up with dry mouth or sore throat. It's common for people, especially for women, to have headache in the morning and then trouble concentrating because of the poor sleep quality. Loud snoring is a common symptom of sleep apnea. It doesn't mean that everyone with snoring has a sleep apnea, or if someone doesn't snore, they don't have a sleep apnea, but it's a common symptom. And then if someone else, like a partner, notices that you stop breathing or choking for breath, for air during sleep. So these are the common symptoms of a sleep apnea. And if people are having these symptoms, it is usually suggested to seek help. The other type of the sleep disorders is very much related to the circadian rhythm that we discussed. And thanks to all the technologies and our lifestyle, we have so many reasons now to have this mismatch between our sleep and wake and sleep-wake disorder. So as we mentioned, our main drive for the control of our circadian rhythm is the light. And then if our lifestyle is different with the daytime cycle, then we get into the trouble with the sleep-wake. For example, common in shift work, people who are having shift works, that they have to either stay awake very late at night or wake up too early in the morning. Another type is that we may experience is with jet lag that happens temporarily when there is a mismatch between the daylight, the light, and then also our internal clock, and to some extent with the daylight saving periods. Next slide, please. The other type of problems that are also common are the sleep-related movement disorders. And these are usually abnormal movements during sleep. There are some major categories, like for example, when the people are having restless leg, they are having painful sensations in their legs or itching, and the factors that really prevents them to have a good quality of the sleep. The other problem is the limb movement disorder. And if you want to think of that in the most severe case, think of someone playing soccer when they're in the sleep. So there's really a lot of kicking happening during the sleep because of the periodic limb movement. And the other common condition is the sleep-related bruxism. That is when the people are grinding their teeth while they're sleeping. Next slide, please. So how these sleep disorders, these wide range of disorders are being diagnosed? What is the solution? René has very nicely mentioned how this is happening, and Opal is so excited to get one of them. So this is what will happen to you, Opal, in the next few weeks. When we want to get these disorders being diagnosed, usually this sleep physician will refer someone to get a sleep study. And in fact, in Ontario, it is happening to the family physician that refers someone for a sleep study in one of the sleep clinics. What the test involved is to record different physiological signals like the breathing, like having something in the nose to know the amount of the air that someone breathes, to measure the cardiac function if someone may have heart disease. They also put electrodes over the head to measure the brain signals and to know the depth of a sleep and whether the people are getting into different stages of the sleep. They also monitor the movements in the leg, in the jaw, to assess those movements that should happen or not happen during sleep. So it's about 20 different sensors that are being attached to the person. It can happen in a clinic or at home, depends on the province that you are. And then based on this information, the sleep physician will assess if someone has any of these conditions like sleep apnea, insomnia, or periodic limb movement. One of the biggest concern with the sleep studies or the gold standard is that it's expensive, at least for the healthcare system. It takes time, and it may take a long time to get into a sleep lab, depends on what the policy of the province is. It could be from like really depending on the condition, it may take between 3 months to 6 years to get a sleep study across Canada. And then one of the biggest challenges is that it's not necessarily easy for the people to go to the sleep labs, especially if they have other care providing conditions. And when they get to the sleep lab and they have all these electrodes connected to them, they may not get a real good sleep because first of all, they have so many things attached to them. And also they have to sleep in an unknown environment. So there are questions whether this test in a lab is a good representative of someone's regular sleeping. Next slide, please. And now we're going to touch very briefly about the sleep apnea treatment. And I know that I talked a lot about different types of sleep problems, but we're just focusing on the sleep apnea because that is more straightforward. The main thing that the treatments for sleep apnea are doing are trying to keep the airways open during sleep. So it could be some changes in the lifestyle, such as reducing weight, because the weight is the biggest factor that basically acts with gravity to close the airways during the sleep. And that's why weight loss is one of the best treatments, especially for mild to moderate sleep apnea. Exercise such as simple walking helps a lot with the sleep apnea and the snoring. And there are devices that are trying to keep the airway open. Like for example, the device here is called continuous positive airway pressure. And what it does is that it pushes air with positive pressure to the airway to keep the airway open. So it's a very mechanic thing. It's not the best treatment for sleep apnea, but that is what is available now. The inventor of this device made a lot of money out of that. And about 30 years ago, when he invented this, he said that if in 30 years we're still using this device, we are in really bad shape. It's very unfortunate that we're still in that position and we haven't found a better treatment for sleep apnea. So if you find one, you will be really, really rich. There are other ways such as surgery to basically either move the jaw forward for the people that the jaw is moved backward to help open the airway, or do some surgeries to remove some tissue from the pharynx to basically, again, open the airways. And there's some oral appliances. They're like mouth guard, but not mouth guard necessarily. These are like individual specific appliances that they put that dentists will design and put in the mouth to slowly move the jaw forward. And all of these are to help to open up the pharyngeal airway and reduce the number of airway collapses during sleep. And sometimes just lying on the side instead of lying on the back helps a lot with the sleep apnea. Next slide, please. Now, we're going to talk about the barriers to access sleep care, both in terms of diagnosis and treatment. So Rene, if...
Sure. Barriers to getting a sleep apnea diagnosis. There may be low awareness of sleep problems. There may be challenges in visiting a sleep lab, such as childcare or elder care, not participating in a sleep study because of fear of losing a bed at a shelter in the case of our study, and lack of trust of care providers. Next slide, please. There may be limited access to treatment options. There might be limited ability to follow the treatment, and effectiveness of the treatment and whether it addresses the patient's concerns is also another barrier. Next slide, please. What happens when sleep apnea isn't treated? The person may experience social isolation because of their snoring, especially if they're in a shelter environment where there are multiple people in the sleeping space. They may feel extra sleepy. That prevents them from engaging in daily activities such as looking for a job, looking for a place to live, having a greater risk of psychological conditions such as depression is also a big thing. And they might feel less motivated overall. Next slide, please. How can we address these barriers to sleep care? We can offer mobile sleep assessment clinics or take-home monitoring devices, bring in more community partners and networks, find the cause of the issue, issues that the person might be experiencing, such as anxiety, income security, housing conditions, or other chronic medical conditions, increase awareness of sleep disorders, more cultural connections, increasing the quality of life for the individual, and honor and include traditional practices. Next slide, please.
And Marisol, if you could please help with this slide.
Sure, thank you. Well, now in talking about how we co-design and co-implement fair access to sleep care, our team is very aware of the following elements to consider in building and co-creating designing research related to this topic. So first of all, everything starts with community's concerns and needs. We are very aware of being informed about what the community need and the interactions between individual, family, community that take place. We also include different approaches to assess sleep problems, the treatment options that are more suitable for the community, and in this case, we are prepared to observe complex terms and practices, which meanings adjust and change depending on the locations, values, traditions, and histories of the specific nations participating or collaborating in the work that we're doing. We also talk about relationality and reciprocity, and these values are incredibly important when doing research, both consistently within the research team and the people, the team delivering the sleep care, and obviously the people that are accessing the sleep care and the health services. And finally, sustainability, understanding sustainability as this interconnection of all of these dimensions and how we can also promote this awareness and this empowerment to communities to access this healthcare related to sleep care services, but also how we can keep honoring and representing their knowledges and their values in what we do with them, in collaboration with them. Next slide, please. Yeah.
Thank you very much, Marisol. And what can we do? Where to go for more information? There are some resources within the University Health Network, especially this excellent and very helpful brochure that is written by Dr. Laurie Bernstein that you can find to the website. And there are also you're always more than welcome to reach out to UHN patient and family libraries, and then the resources that they have and provide regarding different conditions, resources within UHN, and then how to look for a sleep health or a sleep assessment. Thank you, and we're happy to have the questions.
Thank you so much. So that brings us to the end of the presentation component of our health talk. On behalf of our participants and the patient education program, thank you so much, Renee, Opel, and Drs. Campos Naurate and Yadalahi for sharing your expertise and experiences on sleep and sleep disorders. So we'll now check our Slido to see what questions have been submitted. You can still submit questions if you haven't already. To do so, please go to slido.com and enter UHN Health Talk in the event code. You can also scan the code using your smartphone's camera or QR code reader app. And as a friendly reminder, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. See, we have lots of questions, which is wonderful. So I'll start from the top. Okay, so someone has asked, is there any way to access sleep apnea monitoring at home? I heard the technology was developed by Toronto Rehab. Is it available to the public?
That's a great question. And there are ways to assess a sleep apnea at home. And in fact, in the other provinces, the common way of assessing sleep apnea is to give a Health Canada or FDA approved device for the people to take home and do assessment at home. They're different. Some of them record 2 to 3 signals, and some of them can record as many signals as a full polysomnography does. And yes, we have developed the technology at the Toronto Rehab, which is a very small device that attaches to the neck to assess a sleep apnea. And then it is available for the public.
Thank you, Dr. Yadawahi. And how would people access it how would the public access it?
So, I mean, because it has a Health Canada approval, so the people can get it either through their family physician or they can do it on their own. But at the moment, the model is more for the sleep physician to use that. And I'm happy to provide more information and connections to the main investigators.
Great, thank you so much. Okay, let's take a look at our next question. So Steve has asked, hello, I have been through a sleep test and was notified that I do not breathe frequently while on my back. I also have above average sized tonsils, which can also result to snoring and poor sleep. I just wanted to ask if you have any tips for someone like me to gain better sleep. Thank you.
I would suggest that maybe positioning your pillows so that you can sleep on your side may help with the airflow.
Okay.
Thank you.
Also, to make it more comfortable when you sleep on your side and to help you to stay in that position, I find that it helps to put a pillow between your knees. Thank you.
Thank you, Opal, for sharing your tips as well. Dr. Yadawahi or Dr. Campos Navarrete, would you like to add anything else?
These are excellent suggestions in terms of what to do, in terms of trying to change the position of the sleep, because lying on the back is usually the worst position for the sleep apnea, especially when there's the concern of maybe having more tissue around the neck. The other thing is to see whether I could consider to talk with your physicians about the tonsils or other approaches like what Renee suggested for weight loss. And sometimes exercise as like walking helps a lot. So if you could walk for half an hour in the late afternoon, even without changing the weight, it helps with the quality of the sleep and then less snoring.
Awesome, thank you so much. Okay, take a look at our next question now. So someone has asked, how reliable is the Fitbit, so the one with the heart rate, when it comes to getting the sleep score, the length of sleep, and sleep stages?
That's an excellent question, because there are a lot of gadgets that are now out for assessing the sleep. There's Fitbit, and there are different watches, and then even there are a lot of mobile applications that are giving a report of how your sleep was. And the gold standard to know the quality of the sleep, the depth of the sleep, is the brain signals, like to put the electrodes on the head or something relevant to that to know how deep the sleep is and the transition between different sleep stages. And none of these devices are doing that. What they're trying to do is basically try to assess the transition between different stages of the sleep and also the depth of the sleep based on the movement. So they assume that if someone is moving less, then they probably are in deeper sleep. Or if they're moving more, then they are in less deep or more shallow sleep. And that's the main concern or limitation of many of these gadgets, that For example, if someone has insomnia and they lie down in bed for a while without falling asleep and being awake, then the device will think that they are asleep and then underestimate the amount or overestimate the amount of the sleep. And then if someone is sleeping, but they have some of those movement disorders, then the device or the gadget may feel that they are awake while they're actually asleep. So there are some studies that shown that most of these gadgets work well for the people without other sleep problems. But if the people are having sleep problems, these gadgets may underestimate or overestimate the sleep time and the depth of sleep by up to 1 hour.
Very interesting. Thank you so much. I learned so much too, just about the many gadgets that are available now. Thank you. Okay, so let's take a look at the next question. So someone LD has said, for years I have been going to bed late, lately even worse. My sleep average is 3 to 5 hours. Sometimes I feel better on 3 hours of sleep than sleeping in long. How harmful is it? Is it possible some of us can function well on few hours of sleep?
That's a very good question. And then the need for sleep is really depends on different individuals. And also it changes throughout our life cycle. So like as babies, you really need a lot of sleep, up to 20 hours. If you're like my baby, she didn't sleep at all at that much. But in usual, the babies sleep a lot. And as the people age, they sleep less. And then for those who are like older than 65-year-old or 70, it usually ends up between like the recommended time to be between 5 to 6 hours. But those are average for the general population. It doesn't mean that it should apply to everyone. But it could be that in most cases that 3 hours may be not enough, or and you may want to consider talking with your physician. But if everything else is fine, then you're lucky. You only need 3 hours and you're very efficient in your sleep.
Thank you. Okay. Next question. LD has also asked, as we age, do we need less hours of sleep, and how many would you recommend? So I know Dr. Yadalahi, you just mentioned this. Would you mind summarizing again very quickly?
Sure, absolutely. We do need less hours of sleep. And part of that is because, one of the functions of the sleep is recovering and helping the body to rebuild itself. And then also both in terms of physically, like the muscles, and then also for the brain. And that's why the kids and babies need much more sleep, because they need more development compared to the adults and older people. And the amount of the sleep that we need depends on the age. You're absolutely right. And it's about like 7 to 9 hours for adults, older than 20 up to around 50 or 60. And then it goes between 5 and 7 for those older than 60.
Thank you so much. Okay. So another question is, would you please comment on different stages of sleep? Is deep sleep the most important, and what happens when we dream? What could improve our quality of sleep? Thank you.
3 really good questions. So different stages of the sleep are very important, and the deep sleep is the most important. Is very important. I can't say the most important, but the point is a lot of the memory consolidation, like the improvements in our memory, learning new things, and even improving the functionality of our muscles happen during the deep sleep. And also when, for example, someone has sleep apnea, most of those stops in breathing happens in the stage 1 and 2 of sleep, and less in the deep sleep. So the deeper the sleep, the better the quality of the sleep and better benefits from the sleep. And that's why it's very important to get into deeper sleep. What happens during dream? it's a great question. And then there's a lot of different ideas about what happens. And one of those that happened more recently, or is getting more attention, is that during the dream, it's like as if the brain is exploring new paths or new opportunities and learning new things that doesn't know. So like as if getting the information and now going wild in processing those information and making new connections beyond what has experienced. And that's why the dream stage is very important. It also, for different cultures, the dream stage has very important healing effect that I'm sure Marisol and Opal are far more experienced to answer that question. In terms of quality of the sleep, what can improve that is really, there's a lot in terms of the sleep hygiene, that try to have a regular sleep cycle, because then you're basically adjusting your internal clock with the external clock. Try to have less exposure to blue light or artificial light at night, because that is affecting like our hormones or melatonin, and try to have more of red light in the evening. There are studies showing that music can help with the depth of sleep, and other factors, even like the temperature of the room, could affect the quality of the sleep. One of the things that we have done, and I repeat it several times, but it's because it's so good, is exercise. And by exercise, I don't mean like a heavy exercise. Really, half an hour walking in the afternoon helps a lot with the quality of the sleep. And the diet, trying to have food that is not very heavy and fat toward the night will help with the quality of sleep. And I don't know if Opal or Marisol would like to comment on dream and the importance of dream sleep.
I can speak a bit about what happened while we dream, at least from the experiences and knowledges that I have learned working in indigenous communities. We have been told that the brain or bodies are equally active while we sleep, and especially when we are dreaming, than when we are awake. And Asada here is when we wave together scientific and technological research with community and indigenous knowledges. But so what is very interesting here is that the dreams are really related to the context in which we are. And from the indigenous communities in which I have worked, it's so important that we actually nurture the practice of sleeping and having dreams, because we take dreams as medicine. From my background, I am from my family is Nusavi from Oaxaca, Mexico, and we are also Nahua. And the importance of health, like harmonious health in the whole body, is directly related to how we experience the sleeping and dreams. So again, indigenous knowledges are very holistic, and everything is interconnected. So that's what I can say in terms of what happened while we are dreaming is a way in which your body also uses to communicate and connect with your conscious you, especially if you remember your dreams. And yeah, that the body has a whole other dimension of life while we are sleeping. But again, Asada here we'll talk more about the scientific aspects related to that. And Opal and Renee, I don't know if you have any comments on this one.
What I can say about dreams, I know people who buy dream books just to try to understand their dreams, because they see the dreaming dimension as an opportunity to get messages for their life, or to understand some of the problems or opportunities that are available to them in their life, or to get confirmations about where to go and what steps to take in their life. And then there are people that I have met who tell me that their dreams are premonitions, and they will actually dream about somebody and then they will see them, or that person is in trouble, or they need to contact that person, and then they find out that person has been thinking of them. just like in your everyday conscious life, you might think about somebody and either they call you or you decide to call them and they tell you they're thinking about you. The same thing happens in the dream world. And then I've also had people tell me that they've had their spirit guides visit them to guide them and give them messages. So there's a whole lot of things that go on in dream world that we have yet to understand. And I'm just starting to listen to some of the things that I've been told by people who really take the dreaming world seriously and see it as a spiritual phenomenon and as a real thing. And that's why they keep dream logs and talk about their dreams and look for the meanings of dreams. Thank you. Migwit.
Thanks, everyone. It's really, oh, sorry, go ahead, Renee.
And speaking to the improving the quality of your sleep, it's already been touched on, but certainly creating a comfortable environment for your sleep is important, whether that's adjusting the light level, adjusting the noise level. If you have the right kind of music that helps you relax and that works for you, then hey, go for it. Thanks.
Wonderful. Thank you so much, everyone. That was a great discussion. Okay, just taking a look at the time. I think we have time for one more question. So Hugo has asked, how does sleep play a role in cancer patients? Should cancer patients be getting more sleep than normal?
It's a great question. And there are some studies showing about the co-occurrence between some sleep problems and the cancer or the progress of the cancer. And those studies are still in progress, so there's no solid information about that. There are definitely association between these two that, for example, if the people are in pain or in more stress because of the cancer, that could affect the quality of the sleep. But for beyond that, it might be good to talk with your care provider and then see what you need, because the needs for sleep are so depends on every individual.
Great. Thank you so much, Dr. Yadawahi. So unfortunately, it's now 1:58 p.m. and we'll need to wrap up our session. But thank you everyone for submitting all these great questions and to our speakers once again for sharing their expertise and taking the time to answer them. We sincerely apologize if we didn't get a chance to answer your question. I know there were quite a few, but there is still an opportunity to ask. So please email your question to pfep@uhn.ca and we'll help connect with the speakers to try to get an answer for you within 1 week. Your feedback is really important to us. So again, please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera QR code reader app and it'll take you straight there. This link is also in the description box below. And finally, to find out about our next talk, subscribe to our online patient e-newsletter and get up-to-date information about events and new resources at UHN. To fill out a form to subscribe, please go to the link on your screen. If you're filling out our survey right now, don't worry, this link is also available on the confirmation page once you're done the survey. So you'll have a chance to take a look at that afterwards. So thank you again, everyone. Our next talk will be in early December and we hope to see you then. Thank you.